Excellent. Okay, so welcome everybody. Thank you for coming up to the our HEI webinar around the FCP modules. It's great to have so many of you here. As you can see, we've got our panelists all ready and eager to go. So there's myself, Amanda Hensman-Crook, who is Health Education England's Allied Health Professions National Clinical Fellow. We have Richard Collier, who's in charge of the Centre for Advancing Practice, and he's going to be talking to you about the centre and about some processes regarding the taught route for FCP modules. Then we have Julia Taylor, who is our supervision lead for Health Education England. She's going to be discussing supervision in relation to the FCP modules. And we've got Harminder Bains, who is going to talk to you about linking to the primary care training hub. She looks after that nationally, so hopefully it'll be a really useful afternoon for you all. So the agenda, I'll be talking first, followed by Richard, then Julia and Harmy. I'll get them to introduce themselves properly when they come on, if that's okay. The idea is we'll be doing the presentations, then we're going to have a comfort break for 10 minutes and then come back. So what would be really good as we're going along the presentations, if you've got any questions that you'd like to ask, ready for the second half, then please pop them in the chat book. We've got 50 minutes, so if you would like some specific questions, we should have plenty of time to get through them afterwards. Okay, so Darren, please can I have the first slide? Okay, thank you. So I'm just going to give you a quick national update around the FCP agenda, just in relation to the first contact modules. So could you have the next slide, please, Darren? So there's already plenty of universities out there that are developing. I know there's plenty developing multi-professional first contact modules, and we've also got up and running MSK modules and paramedic modules. And we also have some universities that are delivering them multi-professionally. So the purpose of today is so that we can let you know of what the processes are in terms of getting your candidates onto the directory for first contact practitioners, and how your university will be recognised on a list on the FCP portal. So Richard's going to talk much more about that, so I'm going to stay away from that at the moment. Last year, we put out some tenders for MSK modules and paramedic modules, and just so that you know, there will be tenders going out again this year in the not too distant future, so keep your eyes peeled for those coming out. So the knowledge, skills and attributes framework sit in the centre of it all. The knowledge, skills and attributes, they have a central core of capabilities that are uniform across all of the professions, but we also have the superpowers of the professions for MSK, paramedics, podiatry, OT and dietetics, and they all have their own knowledge, skills and attributes framework. So really all I wanted to say this afternoon is that we have all of the knowledge, skills and attributes frameworks for all 5 professions now, and that we will be sending those out to all of the people on this call along with the presentations later on. So I'm going to hand over to Richard to introduce yourself. Thank you, Richard.
Thank you very much. Can I have my first slide, please, Darren? So those of you who don't know me, I'm British Collier. I'm the lead for the Centre for Advancing Practice. By profession, I'm a physiotherapist. I spent quite a long time working in clinical practice and then went into academia before going to HE. So I bring to the centre a sort of a mixture of academic and clinical expertise. So much of what we've been putting in place in the centre, I think those of you who are, and hopefully most of you will be familiar with the HEI's processes. You'll recognise many of these processes as very similar to the processes that you'll go through. So what Amanda asked me to talk about was really the FCP component. But if I may have the next slide, please. I just wanted to go through the timeline really around where we've come from and where we've got to. Now, of course, our timeline in terms of advanced practice precedes 2017. Advanced practice has been around for many years. Those in nursing will make reference to the fact that there's many advanced practice programs around in the late 1990s. So it's been around for quite some time. But and we have to say that in England we were slightly late to the party because Scotland, Ireland, and Wales got their frameworks out before we did, but in 2017 we published the Multi-Professional Advanced Practice Framework. And I think the significant thing there is that it's a multi-professional framework. It's meant to be a framework that spans a whole lot of professions. And one of the big bits of work that we're doing is expanding that list. We're redefining what do we understand as advanced practice. In 2018, the core capability framework was published. In 2019, we also looked at the proof of concept of how the Centre for Advancing Practice might evolve. It was called the Academy for Advanced Practice for a while, but we settled on the Centre for Advancing Practice. Advancing because it's about that journey. It's about taking individuals through that journey, and we recognise that while we're focused a lot on the advanced clinical practice level, advanced practice level at the moment in relation to much of what we do, we recognise that there's those steps beforehand, and FCP sits into one of those steps beforehand. So we recognise that that's really an important role that we have. Our responsibility is quality assuring advanced practice education and training. That's what HEE does. So we have to be very careful that we don't tread inadvertently into making reference to fitness to practice or any of those issues. Those are very clearly sit with the responsibility of the regulator and to a certain extent the professional body. Our role is quality assuring and overseeing the education and training, and it's in that respect that we've been looking at the FCP. In 2020 we started testing how the centre would work, and earlier this year the centre was launched, although we were undertaking quite a lot of the work up until that date in a kind of sort of shadow format. May I have the next slide, please, Darren? We've got a website, and the piece that's sort of relevant to this discussion is the education providers for FCP were starting to be listed. We started to think about how we would list out those providers for first contact practice. The portal that you'll hear about in due course will go live, and the e-portfolio route that will also go live in due course. And then we've got the future ahead of us. The purpose of this this journey, very, very truncated version of the journey, was just to give you some sense of where we've come from and where we're going to. That future will largely be created and formed by many of the discussions that we'll have now and in the future. So I can't tell you where the future is going to be, but what we very much hope is that journey of advancing practice will include the enhanced level, the advanced level, and going on to the consultant level. And I know that many of those individuals that come on your modules will have that journey in mind, and we see Centre for Advancing Practice as being part of the support for that journey. So if I can have the next slide, please, Darren. So really, the centre has 5 key functions. The first is programme accreditation, and we set about looking at those programmes that are delivering advanced clinical practice awards earlier this year. There are considerable number of those programs, and the reason for mentioning that, and I'll tell you that we've got we think there's somewhere in excess of 350 programs in England that have some variant of advanced or clinical practice in the award title. The reason for telling you that is that our work is cut out looking at the advanced clinical practice MSc awards. We're in the process of accrediting those, and we're doing quite well. We could always do better, as is ever the case, but we have a significant number of programs going through that process. It is unlikely in the foreseeable future that we'll be able to take FCP modules through an accreditation process. So the solution is not that we would formally accredit your programs. We're practitioner recognition. So once an individual has successfully completed an accredited programme, they can be listed on the directory as an advanced practitioner. And you'll note that we have got a section of the directory, that's the centre directory, that is dedicated to first contact practitioners too. So we're already looking at how we would recognise those individuals that have gone through some process, which I'll outline in a minute. The directory is being populated at the moment through those individuals that have successfully completed an accredited programme, and in due course that will go live. We've also got a whole lot of credentials. These are bits of learning. I make reference to bits of learning, not a unit of learning. I got told one day a unit of learning was either 10 credits or 20 credits or 30 credits, depending on what your definition of a unit is. So these are bits of learning which are being developed, and there's still some work to do around what the definition of a credential is. And we may have that discussion. We're going through this process of the first 5 credentials have been gone through the endorsement process, and there's quite a lot of credentials that are due to go through those processes in due course. We're not too sure what the FCP modules will ultimately be, whether they'll be defined as credentials or not. That's to be determined. I think the word has a sort of connotation that a lot of people are very wedded to. And then the co-production of the workforce solutions, that's the work that includes the work we're doing around the consultant framework, which you may well be aware is in the process of being launched, and the enhanced framework, which is in the process of being launched as well. So we're in that process, that stage where we're defining the levels above and the level below advanced practice. So those are our 5 main functions. Oh, thank you very much. So when we were looking at what do we do about the modules that are being delivered by HEIs to meet the requirements of the FCP agenda. One question was, do we go through the process of accrediting all of those institutions and all of those modules? Well, I think for the reasons I gave before, that's not a viable option for us. And so in consultation with our lawyers, our solicitors, the question was, could we do a self-declaration? Would it be possible for the HEIs to self-declare that they are compliant with the requirements of the FCP roadmap? And the answer to that was yes, it is. It's a viable mechanism by which the providers could do that. We're also using the same, or we're proposing to use the same mechanism for those universities, those providers that have an apprenticeship pathway which is identical to their standard pathway, or a legacy program which is identical to their standard pathway. They've effectively rolled one program on into another program. So the idea of self-declaration, saying that something that the responsibility is taken by the HEI to state that the program is compliant, is a low risk from HEE's perspective, and it puts the responsibility on the employer, the HEI, to do that. It will require, and what I've done in the next few slides is just put together some thoughts, and I'd value your feedback on some of these thoughts. And again, I think the question was, will the slides be shared? And yes, they will be. Is this proposal viable? We have the letters, the self-declaration letters, currently being drafted by the solicitors, but the process wrapped around it is something that I value your thoughts on as we go forward. It would certainly require the programme lead of the modules and a senior member of the academic staff to undertake an internal mapping of the FCP roadmap to ensure that all the modules are compliant with either stage 1 or stage 2, depending on what you've got to deliver. And I'm looking at Amanda here, so if I say anything, Amanda, which is hideously incorrect, just wave your hand and tell me that's the case. But we believe that internal internal mapping will be very valuable, and it comes to part of the role that we have. We're getting a thumbs up from somebody, that it will ensure that you go through as an HEI that discipline of doing that mapping, because it may well be that you find that your modules are not as compliant as you thought you were. So there's the 2 stages there. May I have the next slide, please, Darren? So these are the 2 ways in which the specific if I got speciality specific knowledge and skill attributes and primary care specific training. This is a sign off prior to commencing work. So these are your 2 routes that were mentioned. That there's completion of this module and the fulfilment of the KSA recognised by HEE, or completion of a recognised portfolio. So I think it's that first one there that we're looking at the self-declaration against. May I have the next slide, please? So these are just some thoughts here. So the self-declaration is the education provider's responsibility to ensure that the modules are compliant and meet the requirements of the roadmap. And as I said, I think that can be done. Self-declaration against taught HI route. Thank you. Yes. So these can be backdated. So if you started your module in 2019 and you've already taken a number of learners through it, and it's the same module that you're self-declaring, then that's fine. It can be backdated. And so that's fine. We're using that principle with the accreditation of programs. So if a full ACP award the program was validated in 2020, then anybody from 2020 onwards can be recognised as an ACP, even if we actually undertake the accreditation process into, say, for example, in 2022. It will enable you to present your modules as HEE FCP roadmap compliant, if you wish to do that, or some variant of that expression. Will enable individuals to seek centre or HE recognition as an FCP via the centre portal, once we have verified that the self-declaration has been accepted. So what will happen is you will provide us with necessary document signed, and once we acknowledge that receipt of that, then you will be able to do that. It'll be your responsibility to ensure the modules are current and that the centre is informed of any changes that impact the modules in any significant way. So if you are if you revalidate the modules, or if there's any significant change, it's your responsibility to flag that up. There will need to be specifically in relation to what each module achieves. Is it stage 1, stage 2, or both? Because we recognise that there are a number of different variants out there. So, and if you've got, and as Amanda said, if you've got specific modules for specific professions, we will need a self-declaration for each of those. It'll be the same mapping exercise. And the next slide, please, Darren. So we'll make that declaration, that documentation available in due course. I'll have to talk to Eloise about where we put it, but it'll probably be on the HE website at some point. We'll let you know. You'll need to self-declare for each of the separate modules, and when modules are revalidated. I think I made that point there. Part of that self-declaration process will include your needing to agree that we can sample you, because, as I said at the beginning, our statutory responsibility is quality monitoring. And so what we do is we recommend that you undertake that mapping exercise before you submit your self-declaration statement, so that we can then ask you, and we will sample, as we're doing with the HEIs for the full ACP awards, or for any individual that goes through the ACP portfolio route. We would ask them to provide us with evidence, and I suggest that if you've undertaken that mapping process of your modules to the knowledge, skills and attributes framework, you'll be able to provide that as evidence that the module is compliant. And I don't know if I think that may be my last slide. Is it? Yep. So I don't know how long that was. It seemed to be about 10 minutes, Amanda.
I think you were spot on, Richard. Well done, really good. Thank you very much. So if you've got any questions for Richard, if you can either pop it onto Slido or into the chat box, that would be amazing. Thank you. So thank you for that, Richard. That was a really helpful presentation. Julia is on next. So Julia Taylor, she's going to be talking about supervision for HEIs.
Hi, everyone. Lovely to be speaking with you today. So my name's Julia Taylor. I'm sure that I've met many of you already virtually over the past 12 months or so. I'm an advanced nurse by background, working in primary care. I'm also a GP trainer and GP training programme director, so very passionate about education and supervision, and have worked very hard with Amanda and the team on the supervision pathways to support the roadmaps. So if we could go to the first slide, please. So today I'm going to be talking to you really about the portfolio tools and the types of supervision that have been put in place and why. So as you will already be aware of, the roadmaps have 2 stages to them, and the staging for all of the roadmaps for all of the professions are exactly the same. Obviously, the knowledge, skills and attributes for each profession vary, but the processes in the roadmap are identical, because we didn't want to have to come up with 5 different things. We wanted a nice pathway that hopefully primary care could become familiar with and know what they were doing with, and also for our practitioners and our educators as well. So as you'll be aware, stage 1 really is focused on the knowledge, skills and attributes to be able to work safely in primary care and gathering evidence around that. So for those that are undertaking the portfolio route, that's where they have to look at any modules they've already done and map that across. Stage 2 is around the application of their knowledge, skills and behaviours in day-to-day practice. And for the FCP modules that the HEIs will be looking at running, that will be encompassing both of those stages. But they have a different perspective, I'm sure you will agree, and we're going to have a look at that and consider that in the next few slides. And Richard's already talked about the sort of recognition of first contact practitioners by the centre. So the process for all of that for practitioners in place already is detailed within the roadmaps. And there's more information to support on the landing page that Amanda has shared the link for within the chat box. If I can go to the next slide, please. So we've got a portfolio of evidence, and I know that practitioners have had portfolios for a number of years, but I think it's quite important that we talk about that this might be something a little bit different. Certainly from our experience over the past 9 months or so, we realise that people have come from very different backgrounds. We have multiple professions. They've done undergraduate courses in a variety of places, different postgraduate experience and working in different areas and clinical settings. So people's understanding of portfolios are a little bit like people's understanding of supervision. There seems to be about 93 million different definitions for both, to be fair. And I think what we need to be clear of for this is that we're looking at a really robust, triangulated portfolio evidence for our practitioners. And that really is important. We obviously need to include the more traditional portfolio stuff. We'll look at the tools that we use in a couple of slides' time, but it's really key that it's robust, and we've been able to mirror what happens with a GP training, because we wanted to make sure what we were doing was of a good standard and was familiar within primary care. In order to support it, we've had to think very carefully about supervision, and all the sort of normal supervision stuff that is around developing the workforce, CPD, peer review and support, that's all really important. But the other thing to consider is that the clinical supervision day to day is a very important thing to consider within this. We are taking practitioners and we are establishing a standard of practice within primary care. And to do that, they need to have good quality supervision with good quality feedback, workplace-based assessments and support in their development. There's already quite a lot of evidence out there, quite a few papers written on transition, where people come from one area and move to another, or move from one level of practice to another, and we know that that can be challenging. So we've worked very hard to make sure that the supervisors that are involved in supporting practitioners on the roadmap have been trained. They're trained to the standards set out by the GMC. And there's more information about what that roadmap supervisor training entails within the roadmap also. We've got a couple of things to share with you in a little while to support the HEIs in terms of portfolio development, so I'll come on to that in a moment. If we can go on to the next slide, please. So as I mentioned earlier, we've been very lucky that the RCGP, the Royal College of General Practitioners, have given us permission to use their workplace-based assessment framework. Really pleased about this, as I said, because the language is familiar within general practice and primary care. We have established GP trainers, GP educational supervisors and clinical supervisors who will understand how to use the workplace-based assessment. They're tried and tested tools. We didn't have to come up with new ways of assessing people, and we've been able to map the assessment tools across to the requirements of the roadmap. So we've been very fortunate to be able to use that framework. If I can go on to the next slide, please. So one of the things, just while we're waiting for that to flip over, one of the things that has been useful is to focus on capability rather than competency for the portfolio requirements. We know that many of the medical royal colleges are moving across to more of an outcomes-based framework, and to make sure that we have, I'm just going to keep on going down the slides, to make sure that we have a flexible workforce. So what we're trying to gather in this portfolio of evidence is that people have the knowledge, and very often that's tested with exams and assignments. They have the skills, and the skills may be tested through OSCEs and DOPS and KEPs, but actually they have the capability where that they can show that they're doing it in their day-to-day practice. So it's that doing bit that is so important, and that's what we're trying to capture. And it's being able to apply it in a room on your own. Primary care can be quite a lonely place to work. We work in rooms on our own very often. So being able to think flexibly, to be able to manage uncertainty, and to be able to apply your capability in different ways. And one of the examples we use is if you think of training someone up to be able to do a female genital examination in primary care, we could tick somebody off as being competent to be able to do that. They know how to use a speculum, and they know actually how to practically carry that out. But what I would like to know, working in primary care, is that that person can adapt that skills and be able to undertake that assessment on a woman who hasn't had children, on somebody who's had a hysterectomy, on someone who's been a victim of sexual assault or FGM. So it's that flexibility to be able to meet the requirements of your patient safely and effectively. How are we doing with the slides? Are we able to move on? Lovely, thank you. So one of these are the main tools that are in the portfolio of evidence that we ask for in the roadmap, and they're very specific and they allow for triangulated evidence to be gathered. So the first couple are really about observed practice, and a consultation observation tool is an extended mini KEX essentially, but it's extended because in primary care that the consultation is so important, and you could do that just through shared surgeries or videoed surgeries, and you could use that with audio cots if you're using telephone or remote type consultations. The clinical examination procedural scores came in to replace DOPS, observed procedures, and allow you to take a much broader range of evidence, if you like, of capability. Case-based discussion, a little bit of a misleading title, that came in to replace a Viva, and that's much more about understanding the knowledge that somebody has and how they're applying it, and the clinical reasoning and the critical thinking, and why are they making that decision, and what were they concerned about. The rest are a little bit more self-explanatory, so multi-source feedback, hugely important. They have to include feedback from clinical colleagues and non-clinical colleagues, and of course patient feedback as well. Reflective learning logs they can use to gather their own thoughts about their learning from day-to-day experience, and so the other bits and bobs from quality improvement activity or audit we would expect FCPs to be involved with, and a way of capturing that involvement would be through the learning logs. Okay, if we could go to the next slide, please. So it's just a little bit of a recap. So it really is about that standard of practice. Whatever we do with HEIs and the taught route, we need to make sure that it's equitable across with the portfolio route. That's really important. It needs to be seen at the same level. So it's about that standard of practice, ultimately safe and effective care for our patients and the public, and capability in primary care so that our practitioners are also safe. They're aware of their scope of practice and how to work safely. The verification process is clear. Richard's talked to you about the self-declaration that HEIs can do so that practitioners that go through the taught route will be recognised. To support you, if we could just go to the next slide, please. There's a couple of dates on the next slide. To support you in understanding the workplace-based assessment framework from the RCGP, a couple of days there in October, where we will provide some background, some context and some training around those tools and what they should look like, give you the opportunity to undertake some COTS and some CBDs and do a little bit of benchmarking and make sure that you're happy with how to use those so that you can incorporate and use those into your tool route. If you would be interested in either of those dates, if you could just email Denise on the email address that's on this slide with any expressions of interest, then we'll be able to work out how many sessions we need and what we want to do to go forward in terms of supporting you with understanding those portfolio tools a bit better. Okay, I think that brings me to the end of my little spiel, so thank you very much.
Thank you very much, Julia. That was a really clear presentation. So next we're going to hand over to Harminder Hensman-Crook Bains, who's going to talk to you about the primary care training hubs and your links to them.
Thank you. So my name's Harminder Bains, also known as Harmy, and I'm the programme lead in primary and integrated care at Health Education England. There's about 132 HEIs present on this call, which I think is fantastic because it just really shows the interest, the appetite for really kind of transforming and growing this provision. My slide, I've not got a lot of slides. Some of you have been pleased with that, but really what I wanted to do is give you a bit of an insight into what training hubs are for those people that have never heard of training hubs, and actually how you can connect to them to support you with this work. So I'm not going to say a lot, and there will be an animation which we're going to show, but before I do that, some of you may have come across training hubs with other names such as CPENs, or community education provider networks, which are CPENs, and they are really, their remit is around supporting the education within primary care. What does that mean? That means really working with practices, supporting practices around increasing placement capacity, and they've been around for some years, but when they were really kind of given what I would say a lot more airtime, let's say, is when they were kind of put into the long-term plan and the people plan, because actually they were there to support some really key manifesto commitments, and those manifesto commitments is increasing 50 million appointments in general practice. And the only way you can really do that is by investing in our wider workforce, FCPs being one of that wider workforce. So what I've done is I've put a bit of a quote in there in terms of our commitment to training hubs and rolling the full rollout of primary care training hubs, and that's taken directly from the people plan. So Darren, I don't know for Eloise, I don't know if you're able to just show that animation. Brilliant.
Health Education England's training hubs are integral to our core purpose of helping deliver excellent healthcare through education and training to our current and future workforce, meeting the priorities outlined in the NHS long-term plan. They are based in primary and community care to serve the local community. By focusing on healthcare priorities, training hubs, in partnership with other educational providers, such as universities and primary care schools, will facilitate or provide training and professional development opportunities for the workforce of today and of the future. Training hubs work with key stakeholders such as primary care networks, sustainability and transformation partnerships, STPs, and integrated care systems to enable educational transformation that is right for the local area. Training Hub's core role is to increase placements by working with educational providers to ensure there are quality learning environments. facilitate student placements in primary care, such as GP practices, to allow learners to gain more exposure and experience. Support the promotion of primary care as a great place to work at all stages of career development from school onwards. Act as a single point of contact for workforce education initiatives in the area, making it easier for individuals to access information regarding education and training. Work with NHS England and NHS Improvement to help retain staff throughout their career from start to finish, for example, through the fellowship programmes. So how can training hubs benefit you? They enable and facilitate new and existing roles in primary care as part of a multidisciplinary team, to include roles such as physician associate, nurse, social prescribing link worker, and clinical pharmacist. They can help to facilitate training clinical staff to supervise or mentor students on placements. They support the development of the multidisciplinary team, and they support the facilitation of CPD of the workforce working in primary care. You can work with your training hub to identify opportunities to upskill, which will ultimately benefit the care your patients receive. For more information, please visit www.hee.nhs.uk/our work/training hubs.
Thank you. If we can go on to the next slide, that'd be brilliant. So whilst we're trying to get to the next slide, I mean, all that's on there is the contact details, but some of the things that kind of resonate with me when I look at that animation, and I've looked at it quite a lot, is that thing around that partnership working, that collaboration. You know, we mentioned universities in that that animation, and it might be that probably not everybody on this call is linked into their training hubs. It might be the nursing team within your universities have linked in with training hubs. So I think the purpose of today was really around understanding what a training hub does in terms of increasing placement activity, but then looking at how you can connect with those training hubs. So perfect timing, Eloise, Darren. So what we've got here is just some resources that will be hopefully helpful for you. We've got, within our organisation, we have regional contacts. And there's a link to those regional contacts, but it's also on our website. We have the ICS training hubs details on there, so you can get in contact with our training hubs direct. I can see Natalie, thank you very much. You've put your details on, and actually I didn't realise that some of our training hubs might be on this call as well. So really do value all the work that you do to support this. So if you want to get in contact with your training hubs, there's two different people you can get in contact with, either the regional HE contacts or the training hubs directly through our ICS contacts webpage. And I just thought I'd plug some other resources on there. You'll all probably be aware of the FCP landing page that Amanda and her team have pulled together, but also the new roles in primary care, because I think it's really important for me to say here, you know, the role of the training hubs, yes, is around that increasing placement capacity, but there's also a workforce planning element, but there's also that integrating into practice. And, you know, whilst we've got universities here, you play a really pivotal role in that transition into primary care. So undergraduates leaving the university and going into primary care. And I know it's not the same necessarily for all those professions, and especially those that have post-qualified, but I think it was worth me kind of giving that plug there. So happy to take any questions, and thank you for your time.